Hello everyone, my name is Jeong, who is the first author of this article. Corresponding author is Jinsoo Chung, and title of this article is Development of Clinical Calculator for Mortality of Patients with Metastatic Clear Cell Type (RCC). From now on, let me start briefing this article. Although small renal masses are detected frequently, owing to routine screening using ultrasonography or CT scan, about one-third of patients with localized RCC eventually experience disease recurrence or distant metastasis. And 15 to 20% of patients with RCC present metastatic disease at initial diagnosis. The patients or their guardians usually ask the physicians prognosis of the patient with mRCC. However, clinical calculator predicting the likelihood of mortality for a given patient do not exist up to now. The aim of this study is to develop the clinical calculator for mortality at 5 years of a patient with mRCC using Korean Renal Cancer Study Group (KROG) database. KROG's database contains individual data on patients with metastatic RCC enrolled in 9 hospitals. It was established based on website system since 2013 to produce major analysis to improve understanding of mRCC. The KROG database comprises of patient demographics, TNM stage and pathology type of synchronous, metachronous metastasis case, lab result, and drug agent of first line, second line, third line treatment, the details of additional treatment, pre-surgical therapy, and follow-up data. We retrospectively analyzed data from 1,115 patients with clear cell type mRCC. They were treated with first-line target agent in 4 hospitals joining KROG between 1993 and 2016. 5-year overall survival rate was calculated using Kaplan-Meier curve. Statistically and clinically significant variables on the 5-year mortality were analyzed with a multivariable logistic regression analysis. As a measure of internal validation, the area under the ROC curve and calibration plot were reported. External validation of the calculator was performed using another dataset from 4 other hospitals. Baseline patient demographics, disease characteristics, and lab results are summarized in Table 1. The mean age at systemic treatment was 60 years. 79% of patients were male, and 60% had synchronous metastasis. The common site of metastasis are following: lung, lymph node, bone, liver, and brain. Sunitinib and pazopanib were 2 most common target agents. The overall response rate was 28%, which included 85 survivors who lived for 5 years or longer. In the multivariable logistic regression analysis, the 5-year death cases, increased neutrophil lymphocyte ratio, synchronous metastasis, low albumin, and low hemoglobin were proven to be the significant variables. Good internal validity was demonstrated with the area under the curve, estimates being 0.774 at 5-year overall survival ROC curve, and with the calibration plot showing the similar observed versus predicted outcome across spectrum of risk group. This table demonstrates external validation of the calculator for 5-year mortality. Within each patient subgroup, there are similarities between the mean predictive rate and the actual rate. We created a clinical calculator for mRCC mortality at 5 years. This calculator is available on the website. If you click this link, and by selecting the significant variables, it shows us the 5-year mortality of patient. As a conclusion, the 5-year overall survival rate in patients with mRCC was 28.5%. Increased neutrophil lymphocyte ratio, synchronous metastasis, low albumin, and low hemoglobin showed significant association with 5-year mortality. A clinical calculator predicting the probability of mortality at 5 years had been developed to quantify the risk of death for individual patients after systemic treatment of mRCC and validated externally. Finally, it would be useful for patients or their guardians who want to know their prognosis and for identifying patients requiring aggressive therapy and additional supportive measures during and after treatment. Thank you very much for watching this video.